Hi, I'm Frankie from Wisconsin Oral Surgery, and today we're going to review some instructions for post-operative care. Whether you've had a single tooth removed, dental implants placed, or your wisdom teeth removed, this video will provide important information on how to take care of that area. Following your surgery, we will send you home with 2 instruction sheets as well as extra gauze packets. If you have these sheets with you, feel free to follow along. In terms of anesthesia, if you've just had your wisdom teeth taken out with sedation, you most likely will not remember the ride home. So try to stay off your phone, and for your own safety, do not drive for the rest of the day. It is important to get some rest when you get home, so make sure that your head is elevated with a pillow. It usually takes a few hours for the anesthesia to wear off, but remember that anesthesia metabolizes differently for everyone, so it'll take varying amounts of time for each person. You should also expect bleeding for the first few hours after surgery. We'll send you home with some gauze pads, and you can use 1 pack per side. So start by opening the pack where you will find 2 pads. Open one up, and then place the second gauze pad inside. You can fold in halves and then in thirds, like so. Once you've completed this, you can moisten the pads, squeeze out any excess water, and place it directly on the site and bite down to apply pressure. Make sure that your teeth are touching when you bite down to ensure that you're really applying the pressure. You can change these gauze pads about every 20 to 30 minutes or when it seems to be soaked through. This should slow the bleeding but not necessarily stop it. It is completely normal for bleeding to occur for a few hours as your body works to form clots. If you're still seeing some pinkish oozing from the site later in the day, this is completely normal as well. Make sure do not rinse, spit, or use a straw for the first 24 hours after surgery. This can disturb the blood clot and cause even more bleeding. If the bleeding is still not slowing down, a tea bag will oftentimes help. First, gently rinse the mouth with salt water, but remember to avoid a vigorous swishing motion. Then, place a moistened tea bag directly over the bleeding area. Then place a gauze pad over the tea bag and bite down for about 30 minutes. Swelling is also a normal reaction after surgery, so do not be alarmed. You can use this ice pack to reduce the swelling of the face. Make sure to switch sides about every 20 minutes and use this intermittently. Remember that this is only helpful for the first 24 hours, so try to get this ice pack on right away. There are some important things to remember about food and drink for the first week after your surgery. Make sure to drink plenty of liquids for the first several days. Stick with clear liquids such as Gatorade and water for the first 2 to 3 hours. Remember that dairy may upset your stomach, so ice cream and shakes should not be the first thing that you put into your body. Eat soft, cold, or room temperature foods for the first 3 to 5 days, and then you can move on to hotter foods. Some great foods to eat include applesauce, Jell-O, yogurt, malts, lukewarm soup, popsicles, cottage cheese, or pudding. Above all, do not use straws for a week because this can lead to dry sockets. Avoid smoking, alcoholic beverages, uncarbonated beverages for up to 5 days. Starting the day after surgery, brush your teeth gently and rinse after each meal with half a teaspoon of salt in an 8-ounce glass of warm water. Those sutures that are in your mouth will dissolve on their own in 5 to 7 days, so there is no need for a follow-up appointment. In terms of exercise, avoid running, sports, and excessive activity for several days. And lastly, there are some medications that you will need to know when to take. Be sure to take all of your antibiotic medications according to the directions on the bottle and to finish out that entire prescription. For pain, you can take 600 milligrams of Motrin or Advil, also known as ibuprofen, every 6 hours around the clock. You will not receive a prescription for a stronger pain medication, but if you have been prescribed one, you can take this in between ibuprofen dosing as needed. If you have had your procedure performed with IV sedation, wait 4 to 6 hours to give ibuprofen. If your procedure has been performed under just the local anesthesia, you can begin taking ibuprofen as soon as you get home. If you notice an increase in pain, bleeding, or swelling after the first 3 days, call the office and we can see you for a follow-up appointment. And along the way, if you have any concerns, please check the website for the office phone number and refer to your post-operative instruction sheets as needed.